There is a great need in the Okanagan Valley for behavioral medicine, and there is a huge void.
The closest hospital is in Wenatchee, which is 90 miles south of us, or Spokane, which is 140 miles. We are basically here in a very rural, remote area.
Our hope is to provide a service so that we can better serve our community as a whole.
We started with a psychologist that we were already referring our patients to, and then we thought, you know, this is working, so we've actually got two other telebehavioral health providers here, one that serves the Medicare population, managed medications, and then the other one offers psychiatric treatment and chemical dependence counseling. They do not manage medications, and they are not billing Medicare. So it kind of covered all of our population and insurance mix by having all three providers here. Financing this model of integration, we had to look at it from being a resource-poor area. So we looked for telehealth providers that billed the patients themselves. Then we were able to capture a facility fee, which actually is more income, and the only cost really then to me is the time of my patient care coordinator.
Due to the area that we live in, we have a lot of socioeconomic issues, and so we see a lot of depression, we see a lot of anxiety, we see a lot of co-occurring disorders with substance abuse, alcohol disorders, and so unfortunately they kind of go hand in hand.
If I'm working with a provider, I ask the questions on the PHQ-9 and the GAD-7 and score them, so the provider has the score when they go into the room.
So how are you today?
The provider is the one who makes the referral.
We then talk to them about the need for cognitive behavioral therapies and our additional support for mental health.
They're usually scheduled with Tracy Miller, our patient care coordinator.
The patient is put in Tracy's nursing schedule and comes in just like one of her chronic care management patients.
I manage all of the telehealth patients myself, and so they're in my schedule. I do the charting for them, I do the rooming for them. We found that it takes that stigma out of having to deal with multiple people.
Usually the patient care coordinator sends a patient referral along with any mental health screenings. Then I call the patient to schedule a telehealth appointment. After I've seen the patient, I fax a copy of my report to let them know that they have been seen, what the results were, and what the treatment plan is.
Those are routed to me, and I see that the patient had an appointment. I don't see the details of that appointment or that discussion, but I know that they were indeed there for follow-up.
I have a manual registry that I update with my patients, and so I keep track of their visits, I keep track of their screening scores, create dashboards so we know when a PHQ-9 is due or when the last one was administered.
The feedback from my clients has been very good. They like going to Mid-Valley Clinic because it feels like they're going there for a doctor's appointment. There isn't any stigma of seeing a counselor.
Once you get in there and you're talking to the telehealth provider and it's a two-way conversation, the surrounding the television set or the computer screen goes away.
I would give advice to other clinics who are considering telepsychiatry, especially rural health clinics, to explore the option because it is working well for us. It does not really cost us anything much, but it does provide that service to our patients.
We're one of the poorest counties in the state of Washington. A lot of Medicaid patients, and services sometimes for them is not readily available. And so we really feel quite privileged to be able to provide this service.
Telehealth has been able to provide us that bridge for that gap where patients would either have to travel to receive services or they would just not even go to services because of that stigma. So we've been able to really provide an incredible service for our patients that we need so desperately in our community because we just don't have these type of resources. And they see the success of it. They really do. The patients come back and they're doing great.
I think it's definitely an opportunity for therapists to be able to serve in these rural areas. I see this as being an answer to the growing problem of access, and I think more people will get on board when they see how successful it is.
There's been such a huge negativity around mental health issues, that we're broken, that we failed as a person if we have this problem. And so, what's great about the integration is that we're breaking down that wall.